Hello everyone, I'm very happy to be invited to give an expert talk on AI in healthcare. In the next 15 minutes, I will be answering the question, AI, are the doctors still needed? My name is Marko Topalovic. Since 2012, I've been a researcher at the University of Leuven in Belgium when I was searching meaning in the respiratory data using artificial intelligence. Since last year, we started university spin-off Arctic, where we are also trying to empower medical practitioners with artificial intelligence. Arctic is a part of my disclosure. To answer the question, I aim to first show you different applications of AI in the respiratory medicine, then I will move on to show you characteristics of doctors in AI, and finally, I will close with the future of AI in the respiratory medicine. Our world has changed drastically over the past decade. With the advent of new technologies, we have seen revolution in many segments of our lives. Self-driving cars became reality. Computers beating world champions is also part of reality today. And we are using technology in all our travels or different transportation. So all of these technologies are having one thing in common, and that's artificial intelligence. Well, what is the artificial intelligence? It's the science and engineering of making intelligent machines, or specifically creating intelligent computer programs. The whole idea is to use these intelligence to augment the abilities of people and enable us to accomplish more by eliminating tedious and repetitive tasks. To explain how does computer become intelligent and start learning, we need to start from ourselves. How do we learn? Well, we learn from examples of different things and repeated practice. Well, repeated practice and examples are key for artificial intelligence as well. We're going to expose the system to examples of behavior we want him to have, and those examples or data and characteristics are going to teach it. So you're going to expose this artificial intelligence or computer to examples of COPD patients, examples of ILD patients or asthma patients, and then the computer should learn those characteristics. So where are we using AI in the medicine today? So the great example and the most common task for AI is the ability to learn from many data and label those data. So therefore, I see ability of AI to help in the accurate diagnosis because it can analyze a lot of tests, X-rays, CT scans, and other data points. Another great application being used nowadays is in the robot-assisted surgeries, where we are seeing Da Vinci platform being assisted in over 5 million operations. Another great application is in the development of new drugs, where pharma is using AI to search new hypotheses and find new applications for their existing drugs. We could also see AI being used, and that's most widely used application in the digital automations, so in mining medical data or managing medical data. And finally, in the medication management, where it is in a former app that can monitor the user medication or assist doctors by bringing alarm on the patient health deteriorations. So what about AI in our world, respiratory world? Well, in the latest review from Sheriff in Thorax, we saw that in the last 10 years, number of publications on asthma has doubled. However, in the last 10 years, number of publications on AI in the respiratory medicine has changed of over 100 times bigger. So for example, last year we had more than 1,000 publications in the AI. And all of those publications and AI applications in the respiratory medicine are focusing on three fields: thoracic imaging, histopathology, and applications in the physiological measurements. I had a difficult task in choosing which papers I'm actually going to show you today. I opt for those that I see being used in a clinical reality or that could be used in a clinical reality. So we are seeing a number of algorithms that are being developed for automated reporting or triage of chest radiographs. And for example, in the paper of Anorama and his team last year, they trained the AI, or actually they teach the AI system an example of more than 300,000 images. And such a system had a great sensitivity and specificity in classifying which radiographs are normal, non-urgent, urgent, and critical. And what I like a lot is that they simulated the radiology reporting pipeline in which where they show that they could have a 4-fold reduction in a delay of reporting of critical findings. Another interesting work was by Huang and his team, where they developed the AI system that was able to recognize lung cancer, tuberculosis, pneumonia, pneumothorax on chest radiographs. And in a head-to-head comparison with thoracic radiologists, it showed better results, and also it showed better results than general radiologist, and actually also non-radiology physiologists. And what I like a lot is that they had another study. They put their algorithm in an emergency department setting, and they found that it could improve the sensitivity of radiology residents in detection of clinically significant abnormalities. And this both papers actually are showing me that it's all about the teamwork, and the AI cannot replace maybe radiology's reporting, but they may act as a competent second reader to reduce perceptual errors. Accurate classification and precise quantification of ILD types on CT images remain an important challenge in clinical diagnosis. So in the work of Wang last year, they developed the Deep ILD, which is a novel software for classification of ILD types. And in a rather smaller dataset of 188 subjects, they reached the accuracy of 88% when classifying between IPF and scans of idiopathic nonspecific interstitial pneumonia or chronic hypersensitivity pneumonia. And furthermore, machine learning is also interesting to apply on HR CT scans. So Welsh and his team applied it 2 years ago, and they reached the accuracy of 73% when classifying CT scans of patients with usual interstitial pneumonia and scans of patients without usual interstitial pneumonia. And I like this paper a lot because they compare this with the experienced thoracic radiologist with a special interest in interstitial lung disease. And their median accuracy was 70%, which again shows me that it's actually a teamwork between AI and radiologists, because AI can perfectly and powerfully serve as a second opinion to them. While still being on the images, I cannot skip to review the current hottest topic, which is the COVID-19. So since the start of pandemic, there has been so many research papers and companies who were developing different algorithms to tackle this issue. So quite some companies made AI algorithms to triage CT scans and detect the presence of COVID in it. So as you can see in this example, on this CT scan, this algorithm is 87% sure that this patient has a COVID-19. And what I like, for example, in the paper of Lee, is that they had, in a big data set of more than 4,000 patients, great results because they reached the almost perfect accuracy in detecting COVID-19 or differentiating COVID-19 from community-acquired pneumonia and other lung conditions. AI techniques have also been successfully applied to digital histology images, particularly in the field of lung cancer. So Kudra and his team showed last year that they were able to discriminate between different carcinoma cells with a comparable accuracy as the expert pathologists. What I like a lot in this algorithm is that it was able to predict the 6 common gene mutations of therapeutic significance with actually quite good performance. However, even 5 years ago, this was an interesting field for machine learning or AI, because Kim and his team developed a classifier for ILD based on the high-dimensional transcriptional data from surgical lung biopsies. And this algorithm was already having a quite good performance. However, in the next study, they also found that their molecular classifier accurately distinguished between usual interstitial pneumonia and non-usual interstitial pneumonia in less invasive transbronchial biopsy with actually quite good sensitivity and specificity, which kind of suggests that this technique could avoid the need for surgical biopsy in some cases. Interpretation of pulmonary function tests has traditionally been considered as an important aspect of expertise of respiratory physicians. Our team developed last year an AI system using 1,400 historical cases, and we showed that we could accurately differentiate between 8 disease categories. And in a head-to-head comparison with 120 European experts, we showed the accuracy of 82%, which outperformed experts by the wide margin. And again, This highlights the potential for a teamwork because AI can serve as a powerful decision support system in the daily clinical routine. Similar results we show from the paper of Nilakash Das this year on a spirometry quality control, where we saw that if we apply AI for the quality control, we can reach the human level of the expertise. Finally, we are seeing AI being applied on a lung sound analysis with the aim to detect asthma COPD or ILD. Here I highlight the paper of Bardou that was able to differentiate 7 lung sound categories with the accuracy of 95%, although still in a smaller dataset, but still remarkable results. Last application that I'm going to talk today is about sleep monitoring, because we are seeing a lot of research, a lot of papers, a lot of companies being involved in obstructive sleep apnea detection, where I highlight the paper of Nikonen, because they had an accuracy in 2 datasets of more than 90% when detecting OSA and different stages of obstructive sleep apnea. Finally, I want to approach the end of answering the question of the future of AI and the doctors. So there is a common discussion and comparison of AI versus doctors. And you saw this in my previous slides, that many studies had this as the outcome. But however, I truly believe that the aim of these studies was not to prove that AI will take over the job of doctors, but to use human level of performance to judge whether AI is really well made. AI is in essence a great technology, and as the tool should serve doctors to improve the work that they are doing. So I still see a room to complement each other, and here is the difference I want to highlight. The first difference is in the multitasking or tasking and robustness. AI can learn to perform a task perfectly, a good, or even better than humans. And such tasks, as you saw in the previous slides, are diagnosis, pattern recognition, and so on. So they do this to help doctors to reduce errors, reduce chance of misdiagnosis, and reduce chances of mistreating the patients. However, doctors are still able to do a lot more. They are trained to do multiple tasks. For example, pulmonologist can interpret pulmonary function tests, but he can still talk to patients. He can still listen to their sounds of the lungs, and they can still give their medication. So moreover, the doctors are what I called robust systems, because they can adapt their knowledge. And for example, if they see the images from different hospitals, they can still make a decision whether for AI this may be a question mark. Another point is the time and the effort. So in the United States alone, the average doctor spends 9 hours per week on administration. And these types of tasks and procedures can be automated, and they should be. So AI can go through the documents and data points in a second, create automated reports, and save time for everyone. On the other hand, AI cannot do some other tasks, more complex tasks that are perfectly suited for humans, such as intubation and Heimlich maneuver. Finally, we cannot replace the empathy. AI will objectively predict which treatment fits the best for the patient outcomes that we want to achieve, or it will predict diagnosis that corresponds to the patient data and symptoms. On the other hand, we still need the doctors to hold our hands while telling us the truth about life-changing diagnosis, to guide us through the life-changing therapy and give us the overall support. Taking all of this into account, I want to close this presentation and answer my question that it has never been AI versus doctors. It is not AI versus doctors, and it will never be AI versus doctors. It is actually AI and doctors. So we are having this constant enemy image building that is either one or another, and this has to stop. Technological innovations always serve the purpose to help people, and we are playing on the same theme, and it is a matter of utilizing the power of the teamwork to grow our healthcare system and finally secure the best possible patient outcomes. Thank you very much for following my presentation last 15 minutes. I would like to end with my vision on the future and with my contact in the case you would like to further discuss my views. Thank you very much.